Welcome to the Office of the Attorney General's SURG Prevention Subcommittee meeting for the Substance Use Response Group. Today, August 7th, 2024 at 3 o'clock. I'm Jessica Johnson. I'm the chair of this committee, and it is 3:02. So let's go ahead and move to agenda item number 1, call to order and a roll call to establish quorum. We'll turn it over to Ms. Rodriguez to help establish quorum today.
Thank you. Senator Fabian Doñate. Jessica Johnson.
Present.
Debbie Nadler.
Present.
Angela Nichols.
Present.
Eric Schoen.
I'm here.
Great. Chair Johnson, we do have a quorum, and I believe Senator Doñate will be joining in just a few minutes.
Fantastic. Thank you so much, Ms. Rodriguez. Let's go ahead and move on to agenda item number 2, which is public comment. Public comment will be received via the Zoom meeting. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public and if any discussion on those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on the agenda. Oh, sorry, there is some background noise. If folks, thank you, could mute themselves, that would be great, unless you're getting ready to be in line for a public comment. Until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. Ms. Rodriguez, any other important details for folks before we open public comment?
I will just read out the dialing in information. So if you are dialing in from a telephone, please dial 253-205-0468. And when prompted, enter the meeting ID, which is 825-0031-7472, and press *6 so that we can prompt you to unmute.
Thank you, Ms. Rodriguez. Do we have anyone for public comment?
Sorry, this is Debbie Nadler for the record. My raise your hand button is missing, but I do have a comment, but if that's okay.
Ms. Nadler, you've been recognized for public comment.
Thank you very much. Glad to hear everybody today. I just want to let everybody know that the sign will be lit purple for International Overdose Awareness Day, and they're actually going to light it for us from Thursday to Tuesday since it falls over Labor Day weekend. We're holding an event. Anybody who wants to come, if you've lost a loved one, you just want to be there. It's at 7:30 Saturday night, August 31st. So that's it. Thank you very much.
Thank you, Ms. Nadler. To just note, raise your hand function for anyone else who's looking for it can be found under the reactions tab on Zoom. Ms. Rodriguez, do we have anybody else for public comment?
Chair Johnson, I do not see anybody else indicating that they want to provide public comment at this time.
Wonderful. Thank you so much. We will close agenda item number 2 then and move on to agenda item number 3. This is a review and approve the minutes from our June 5th, 2024 Prevention Subcommittee meeting. I will take a moment and then entertain a motion for approval of the minutes.
So moved. This is Eric for the record.
Thank you, Mr. Schoen. Do I have a second?
Second, Debbie Nadler for the record.
Thank you, Ms. Nadler. All in favor say aye.
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 Any opposition? Opposed? And any abstentions? All right, minutes have been approved. Thank you. With that, we'll move on to agenda item number 4. Agenda item number 4 is an update on the harm reduction shipping supply program. We have Rick Reich, who's the program director for Track B Exchange, and Kat Reich, who's the administrative manager for Track B Exchange. And before I turn the floor over to Rick and Kat, just wanted to kind of orient those on joining us today and elsewhere. Really, the goal of for this year's Surge Prevention Subcommittee is to refine the recommendations that we came up with in 2023. And today we're doing a deep dive into the harm reduction recommendations that we entertained in the last year. So today's goal is to hopefully get through all of those in the time that we have here today. So I wanted to thank Mr. Reich and Ms. Reich for joining us today. They were provided a copy of the language related to our harm reduction shipping supply recommendation, and we're able to provide some additional justification and background and text that I will work to summarize and present back to the committee when we do a full review of our recommendations in, I'm going to say, at the fall meeting in September, I believe. Kat and Rick, I was hoping if, as you looked through this recommendation, if you had any suggestions for the committee of particular changes that you would make. For example, if there are challenges with the current implementation of your shipping program or barriers that this committee should know about.
Rick, do you want to take the lead on this, or am I?
There, I had to find the
Okay, there we
unmute
go.
button. Yes, there's a couple of things that I would just add into this section in terms of shipping. We had about a page and a half of conversation about why shipping is important and what it reaches and who it reaches. And I think the biggest thing I want to add is that shipping, just like vending, is sort of a non-judgmental type of interaction. It's not one that you're face-to-face with an individual in an actual agency and addressing issues. They don't have to talk. They don't have to do anything but just request something and have it sent to them. It also allows for you to add information into the shipping container for people that they may not take when they're in a storefront. They come in, they get their supplies, you ask them if they want any other information. No, out the door they go. You have about a 5-minute window there usually of interaction. By putting information inside the vending products and the shipping containers, the boxes that we ship it in, it allows us to get certain messages out there that might be of importance for someone in that particular area. I mean, right now we're shipping about 40 packages a month. And just, I went through just real quickly where they were going, and you're talking about Ruth, West Windover, Elko Nye, Winnemucca, Fallon, Sun Valley, Sparks, Pahrump, Lovelock. I was just coming off a couple sheets. So there's a regular process of this stuff getting shipped out, but it's not anywhere near its capacity of what could probably be done. This is literally word of mouth, people getting onto Nextdistro, finding the site and asking for supplies. And we have not ever tried to do anything locally, and I say locally in terms of the state, of trying to get information out there to the rurals and to other areas to promote this. I think that one of the things that comes into the cost of that is how you advertise it, how you interact, what you do to get that information out there? Do you work with local agencies? Do you give them information to pass out? Do you advertise in a local newspaper or bulletin board? One of the things that we have found that is very successful is picking up sharps. People want to get rid of sharps. They don't know how to do it. You go to CVS, go to Walgreens, and you find a package that costs you $20–30 to mail in a little 1 pint type of container with a few needles in it. It doesn't cost that much to get rid of this stuff when you're doing it in mass. And one of the things we've tossed around is trying to align with some of the agencies out in the communities in rural Nevada and have bi-monthly pickup dates where we take our van and we go out and we pick up trash cans full of sharps and sharps containers and then come back and destroy them. But that would also give a way of getting information out there at the same time. Another way that we proposed between us was we were throwing around ideas one day was just taking and shipping sharps containers up to the prevention groups in most of the communities that they can hand out themselves with something attached on it of how to contact us about disposing of needles or when we might be in that area to pick them up. I think those are pretty much the biggest parts of this. I do want to emphasize that in terms of harm reduction, shipping, supply, it's a very cost-effective way of getting supplies out there. You have one person putting supplies in a box and labels on them and shipping them. We do not ask for all kinds of personal information, so it is a little bit more anonymous than coming in face to face.
Thank you for that summary, Rick. I really appreciate it. It sounds like perhaps one recommendation might be to modify this recommendation to expand, to be able to build on what is already happening in terms of shipping rather than provide for. So that could be a recommendation. My question was about cost. I was wondering if there's a cost estimate for the program itself and then a cost estimate related to the sharps collection, if that's separate. And then I'm happy to take questions from the committee.
Okay. In terms of the cost, you're talking about for a package to go out. Each package, usually once a month, is approximately $12. The supplies in those are primarily syringes, alcohol wipes, and a sharps container. The syringes are provided by the state. They have given us a contract to provide syringes to everyone that wants them. We have an abundance of syringes now, whereas before we didn't. So we can package the stuff fairly easily. If we add other things, that's where the expense comes in. If we're adding wound care kits, things like that, that will add a little cost to it. A sharps container is roughly $2 to $3 each. The syringes are about 6.5 cents each. In terms of returns, this is an area that is kind of my focus for the future. We have actual supplies that have been donated to us to get returns legally in the real hazardous box shipping containers. To describe one, it's a cardboard box. It holds a 1 liter can that looks like a large paint can. You pop the lid. It has cushioning inside to hold the sharps container. You put that in a bag, you seal it, put the lid back on, you put some more foam in that's already there, tape it shut, and away you go. So those we have 500 of right now that would get us started returning syringes straight to us by the mail. That would cost us almost the same amount, if not a little bit more than what it costs to mail the syringes out. So you might be talking for every batch that goes out, you're talking probably in the neighborhood of a $25 to $35 cost per, let's say, individual per month. The second part that you wanted, Jessica, was what? You asked me about cost, and you asked me.
Yep. I think you mentioned both of them, the current cost for the packaging. Sorry, I couldn't find my unmute button. And
Okay.
then the cost for returns. So thank you for answering those questions. Ms. Nadler, did you have an additional question? I see your hand up.
Yes, I do. Thank you very much for what you're doing. So needed for our community. And I might be confused, and excuse me if I am. So I know you're talking about the sharp boxes, but is there a separate box for naloxone or fentanyl test strips? Or I
No,
see that on here.
They go right into the same box. Yeah, they go into the same box. We're using a lot of the postal boxes, like a priority mail flat rate. So we'll use one of them and we'll pack as much stuff as we can get in there and tape shut. So test strips will go in, naloxone goes into every package that goes out every month. We have used both nasal and injectable, depending on whatever availability is. Test strips the same way. This is what we do in the vending machine is what we're trying to do in mail order, so to speak, because it's the same anonymous, non-judgmental approach to reaching people. I hope that answered your question, Miss.
It does somewhat. There was another part to that question. So when they order, do they put a checkbox on what supplies they need, or it's just automatically what you're talking about, what it includes? And is there a limit? Like, do you put a limit? Or do they say I need 2 or 3, or it's just one box?
We will ship as much as they need. Our boxes currently are boxes of 100, and we break those down into components of 10s. So we might ship 40 syringes in a box, along with a sharps container, along with alcohol wipes, a tourniquet or 2, and some first aid equipment, then naloxone and some test strips, and then information on how to use it all. The reason that we don't just ship 2 or 3 or 400 syringes at a time is that our own experience has taught us down here in Las Vegas that the whole idea behind harm reduction is to interact with people to get them to lessen the harm upon themselves of what they're doing. One of the ways that we feel very strongly we can help that cause, so to speak, is to interact with people. And whether you're interacting with them by sending them mail products, or interacting by them coming into the storefront or hitting the vending machine, the idea is they continually use the service, and that way you continually can get messages to them in the form of a sticker on a product, or a brochure in a box of syringes, or something that's holding all the alcohol wipes in a packaging, any which way we can to get what I would refer to as narrow casting a message to that individual. People that come into our storefront average about 45 to 52 times a year they drop by. And that means 45 to 52 times we have to interact with them about naloxone, about test strips, about condoms, about treatment, about peer services, and so forth.
Thank you.
I think that's great. And lastly, when you're mailing something out, does the receiver have to sign for it, or it's just dropped off?
Nope, it's just dropped off. It's just like a priority mailbox that you get at your door that you never heard the knock, you never heard anything, and you open up the door and you trip over the box because the postal guy just left it there. That's about the way that most of them go out. We do not require any signatures. We do not require their full name. We may send it to somebody care of. We can send it by initials. We do have to have a physical address, though. When we report this in any way out to different agencies, we deduct the name, we deduct the address, and all we leave is the city and the zip code. That way they can say, well, that's West Wendover, that's Sparks, or that's Henderson, or that's Laughlin or Mesquite. But it doesn't tell you whether it's a male, female. And we're not really interested in their gender or anything like that. We're just interested in them getting safe products to use.
Yeah, I think it's great. Thank you so much. I was just worried that perhaps a kid would get the box, a kid would open it. I mean, there are circumstances. I know my grandson opens every box that comes to his parents. That's all. I was just thinking of that. But
Thank you.
I'm sure.
Thank you, Ms. Nadler. Sorry, in the interest of time, I do want to take Mr. Schoen's question. We only have time for kind of one more question to move we have a full agenda today. Mr. Schoen, the floor is yours.
Thank you, Chair Johnson. Hey, Rick. So two quick questions. I hope they're quick. The total need out there, how much do you think you are currently filling of that need? 5%, 10%? Do you have an estimate?
I would have to say, just looking at the numbers in the communities that we see, if you were to just make a number up, 1% of the population uses some type of illicit drugs. And I'm making that up, by the way. And you take a community that, has 100 people in it, that's one person, times, let's just say that there's 600 or 1,000 people. There should be maybe 10 people that are using in that community that we should be hitting. When I go through many of the rural communities, I only have one, maybe two people, or I should say addresses that we're mailing to. That's not to say that there isn't like 2 or 3 people sharing boxes and then just requesting more as they need them. But I would say that we're barely breaking the surface on what we could be doing out in the rurals in terms of mail. I know that vending is a little bit more problematic, and it's more of the urban cities that can benefit from that. But the mail, it's kind of like Amazon. It's there, you order it, it's dropped to your door. And the fact that we can keep dropping them over and over and over gives us that ability to then also communicate with those people. And then we hope that they would communicate by us by phone or something if they need something.
Well, I appreciate it. And let me just briefly tell you where I'm going with this. Maybe Kat might have an answer too. I'm trying to figure out if we knew that you were roughly hitting 10% of what the need might be, and your current budget is $50,000 a year, then to hit everybody, we would just multiply that times 9 or 10, get up to $500,000, and that could become part of our recommendation. That's kind of what I'm trying to get that kind of specificity. Kat, do you have anything that can help us?
Yeah. Can you hear me?
Mm-hmm. Yep.
Okay. Yeah, I would say that for any of the communities that we're reaching, we're definitely reaching less than 10%. We don't have enough community buy-in that's sharing via word of mouth. The program is there, which is part of why there was that bit that Rick recommended with potentially with the pickups. We do that in conjunction with community partners that are already in those places that people trust to kind of help spread that word and spread that this exists. But I would say even with having clients that I know do secondary distribution amongst their community with what we send them, we still are not hitting the number compared to the number that we know that use in those individual towns.
And
So
what's your
I would say it's less than 10%.
And what's your current annual budget for shipping?
That one is a Rick question.
Could you repeat it?
Yeah, what I just asked, what is your current annual budget for shipping and providing these supplies?
It has decreased this particular year. We've had a little bit more fluctuation in numbers, and that's why I averaged at about 40. Previously, we had been up as high as 50 and 60 per month. If we were going to do returns and so forth, a ballpark number that I would put on that would be somewhere in the neighborhood of $40, increasing from 30 up to 40 to cover just any of the other incidentals that have to go in the packaging of supplies. And I would say that, you know, we're pulling in an average of 40. We could increase that probably to, in the first year, to 60 to 70, and hopefully thereafter push that number up to probably closer to 100 a month going out, hitting, and I'm talking there are areas that we can't get to.
Yeah. Rick, sorry, I don't mean to interrupt you. This is Chair Johnson for the record. In the interest of time, I know, Mr. Schoen, to your question, perhaps we can connect back with the Impact Exchange team. If there's a ballpark for this initiative presently, then I think our committee would be happy to take a stab at revising this particular recommendation with some of those expansion details. Eric, I think that's where you might have been going with your question.
You beat me to the mark. I was just going to say the same thing. So nicely said.
Yeah, wonderful. Thank you so much to Rick Reich and Kat Reich from Impact Exchange, Track B Exchange for helping us weigh in on this particular recommendation. You are both welcome to stay on as SMEs for the rest of the meeting, but I also recognize how busy both of you are and the details of running a storefront exchange. So thank you for your work today and your work always in these pieces.
And Chair Johnson, I just wanted to note for the record that Senator Doñate is also in attendance.
Wonderful. Thank you. Welcome, Senator Doñate. With that, we're going to move on to agenda item number 7, which is a discussion and revision of our other harm reduction recommendations. So in addition to the shipping supply recommendation, we had 6 additional harm reduction recommendations that were included in the 2023 annual report. So the following slides are kind of a summary of those recommendations and include the justification, action steps, impact, capacity, feasibility, urgency, and racial and health equity. We have a few community subject matter experts. So Marco Mendez, Chelsea Cheatham, and Jose Escobil, who's the director of the Colorado Consortium for Prescription Drug Abuse and Prevention, have all been invited to attend this meeting, in addition to the committee, to help provide insight on these recommendations. If you're looking for a handout with the full harm reduction language that's presented in an abridged fashion here, it's posted online. And the details are also provided, as I mentioned, in these PowerPoint slides. For the other sort of more prevention-focused recommendations, we'll be discussing them at our upcoming subcommittee meetings in more detail, and I'll also on agenda item number 6, provided we get there for time. In the interest of this discussion, I know we have Mr. Escobil joining from Colorado, so I was hoping we could start by moving to recommendation number 10, which is around creating a bill draft request at the legislature to change Nevada paraphernalia definition as it relates to smoking supplies. Mr. Escobil has been involved in some efforts in this in the state of Colorado, and I really wanted to welcome him today and If you could give us a little bit more of your background, thank you for joining, and educate us on some of the work that you did on behalf of Colorado for this legislation.
Wonderful. Thank you so much. And good to see you in this context outside of the vending machine world. So good afternoon. My name is Jose Escabel. I serve as the director of this consortium that is housed at the University of Colorado's Anschutz Medical Campus. Basically, this group's been around since 2013, having been launched by Governor John Hickenlooper with some funding from Attorney General Suthers. And really, the group has helped to coordinate the statewide response to the opioid crisis, from prescription drugs through heroin, now with fentanyl. I came on board as director of this program in 2019. And previous to that, I had spent a little over 4 years in the state attorney general's office. So I was the director of the Office of Community Engagement underneath Attorney General Kaufman, appointee of Attorney General Kaufman, and then for a brief while, appointee of Attorney General Weiser. And I also had the privilege when I was in the Kaufman administration. I serve, for those of you that know about NAGTRE, the National Association, Attorney General Association for Training Research, I was part of the original team that trained deputy attorney generals across the country in preparation for the settlement starting way back in 2017 or so. So I've been sort of had a finger on the pulse of this work for quite a while. And one of the things we started doing here in Colorado in 2017, we began working with our state legislature, and they formed an opioid and other substance use disorder study committee, an interim study committee, in which we were able to bring subject matter experts from the fields of prevention, harm reduction, treatment, recovery, and alternatives to criminal justice incarceration to start helping to not only update our drug policy laws, but we were very intentionally, we're putting together enabling legislation to make the best use of opioid settlement funds. And so we've been doing this legislative work for quite a while. And I want to talk about this harm reduction work because we've worked with harm reduction professionals in the field. We've looked at what's going on across other states. We've looked at some of the LAPA model laws. We've worked with the National Public Health Law Network to gradually keep improving things. And so what I want to address here, can I do a share screen? Do you mind if I do that real quickly? Because I wanted to show you some things that we did recently because of the changes in the way that people are using drugs, moving so much away from needles, where we've had syringe service programs, but now more towards smoking. We had to do some updates. And we heard that clearly from our harm reduction people in the field. No, let me find I misplaced my screen. Hang on just a moment. Let me get out of here and let me get my right screen. I want to show you the recent bill that we just passed because you're going to see how simple this really is. And certainly you can check in with some other states around this as well to see if this is something you want to do. But I do want to point out some considerations and then I'll take some questions. Why can't I see my screen? Let me see. I don't know if you're seeing, are you seeing the section 5? Yes, there it is. You seeing that? Okay, this is our recent bill, House Bill 24-1037, and we have 3 sections here pertaining to some of the subject that you're interested in. But one of the things, if you're considering making some changes or additions into your policies around harm reduction, it's important. We had to do a combination of things, and I'll show you the other part in a minute, but it's through our syringe exchange or syringe service programs that we authorized several things to occur. So this is not just blanket for anyone in the whole state, but we had to make sure that we had this protection of people who receive supplies from harm reduction, and that includes not only syringes, but now includes smoking materials. But we had to make sure that the drug paraphernalia law applied to that particular statute. So you're going to see some statute citations here, which you wouldn't normally, when you look at this, you wouldn't think it applies to the smoking supplies, but when you actually look at the statute, it does. So you have to do this in conjunction with what's your drug paraphernalia possession law say, and make sure there's some exemption for folks. And then if I can get to section 7, this is how simple it was for us. Now, in Nevada, I don't know where these statutes exist or where they are, but in our state, they're underneath this Title Clean Syringe Exchange Program is where they're under, and we still need to update that language, I think, at some point. But what we added here is we added this language here that these harm reduction programs, basically, is what they are. They may purchase and distribute other supplies and tools intended to reduce risks. And we made sure to say including but not limited to the smoking materials. And so that was something we just wanted to make sure got in there as well. Now you may find some model language from some other states to that effect, but this is basically what we were able to do. And then we added this piece here that that people may acquire and use supplies or devices intended for testing. So that was the other thing we had to do is, with fentanyl test strips, things like that. But that's really what we simply did. We just added this to an existing piece. So now this bill is large because it's sort of a smorgasbord. There's a bunch of other aspects of harm reduction in here, not just related to this piece here. So I'm going to stop here and see what kind of questions do you all have around your consideration for this. Questions, concerns? Okay, it seems pretty clear cut then. Jessica, how do you want
Mr. Esquivel, I just heard from Jessica, she's frozen on Zoom, so.
Okay.
Oh, my apologies.
I was wondering about that.
Can you hear me now?
She hasn't moved. Yes, we can hear you.
Wonderful. Hopefully, nope. Okay. Hopefully you can still hear me. Okay.
Yeah,
Yes, we can
Looks
hear
like we
you.
have a question here.
Thank you.
Fabian? Fabian?
Thank you. Ms. Johnson, am I good to proceed?
Yes, if you can hear me. Sorry, I'm going to try to call in.
Thank you. Not really on the policy framework, but more on the initial feedback that you received. How was the perception when the bill came through the Colorado legislature? Was there pushback from some of the police departments or those in law enforcement? Was there general opposition? I think that's probably a good conversation to have, especially considering the magnitude of this. So,
but no, we
yeah.
didn't have any of that on the harm reduction bill. That one flew through really well. We've had some really good working relationship with law enforcement and harm reduction. And some of this started when I was in the AG's office, and AG Kaufman, we did quite a bit of work with law enforcement and educating them around Narcan and understanding these policies and what they are intended to do. And I think the other reason maybe not a lot of attention was given to this bill is because we were also running a safe use site bill, and that one, the one that received a lot more of attention and resistance. And so, so I think maybe that might have diverted some attention from folks because of that particular bill. But no, we had no resistance. This one sailed through pretty well. Certainly, the votes, if I went back and looked at the votes, they were probably all partisan votes anyway. We have a majority Democrats, but nobody actually tried to kill the bill. But I don't think we got huge support from the more conservative members of the legislature. Any other questions? Okay. And certainly offline, outside of this, if there's more conversation people would like to have around some aspects, I'm more than willing to have a conversation outside of this venue. All right. Thank you.
Can you hear me, SURG committee members?
Yes.
Yes.
Okay, wonderful. I'll mute on my end. This is Jessica on the phone. My apologies. My Zoom is timing out. I just want to say thank you to Jose for joining us today and for providing an overview of how Colorado has looked to tackle this particular piece of legislation. Really grateful for your leadership and time today. Thank you. If there are no additional questions on this, and we can hop back to the presentation for number 10, Emma.
Yes, so Chair Johnson, this was our recommendation from last year regarding the smoking supplies. So, and I believe the handout has the full suggested language. I couldn't fit it all on this slide.
That's okay. My slide is still showing Mr. Esquivel's screen, so I apologize for the technical difficulties. I may need to log out and log back in. I don't know if my vice chair is available to hop in to facilitate any additional conversation while I do that.
Sure, I can hop in. This is Eric for the record.
Thanks, Eric. I appreciate you. Emma, I'm going to log out and log back in.
Okay, no worries. So, Emma, it looks like are we on a new screen here? Or are we, it's just a,
So, the way these slides are set up is, they're all the remaining harm reduction recommendations that were included in the 2023 annual report. So the one we were just on is related to the, smoking supplies. So based on what we heard from Jose, the committee could seek to edit this now. Or someone could volunteer to take this back and work on it and bring it back to the next meeting.
okay, so what I'm hearing, and I'm just now catching up, and I would appreciate grace from folks. I was gone last week, so I'm running fast to catch up, is that if we can finesse this a bit, make it a little bit more targeted, that would be a good thing. So I guess I'm looking to committee members who are on the call to see if there are any ideas or any appetite or any thoughts about how we might do that for this particular section. Recommendation. I will admit at first blush it's intimidating to look at this because there's so much packed into this, but Senator Doñate, do you have an idea?
Yeah, my honest feedback is this is a very touchy subject, and I think it's important that we include law enforcement to be a part of this conversation, specifically anything dealing with paraphernalia. I know that there's been state trends to look at decriminalizing it. Obviously, we've had that discussion in the legislature, but anything revolving changing the definition or regarding the criminalization aspect of it, I think it's important to have them as part of that discussion before we decide to put a bill draft request forward. That's my only recommendation.
No, I appreciate that. So when you look at this, you see, hey, you know what, I'm not sure we've done a good job of including the voice of folks from law enforcement. Let's make sure we reach out to them and see what thoughts they might have, what their feelings might be around this, what their appetite around this might be. Debbie, you have some thoughts?
I totally agree with the senator. Yes, absolutely. I think we should get the law enforcement and other entities involved. Thank you.
So then I'm going to just ask the two of you, since you both chimed in on this, do you guys have any, or I guess anybody on the call, anybody have a recommendation for who would be a good presenter from law enforcement who could give us a sense or an idea of the thinking?
Hi,
Eric.
this is Chair Johnson back online. Sorry, just wanted to touch base before that. And I see Dr. Terry Kearns is on. Dr. Kearns, did you have a recommendation?
I did. I would offer that we do have Christine Payson, who's on the SURG, and she's the representative from the Sheriffs and Chiefs, Nevada Sheriffs and Chiefs Association. And I'm sure that if we provided this to her, she could take that back to the membership and get feedback from them.
So Chair Johnson, I will turn this back over to you. Thank you, Terry. What, can't hear you, Jessica.
All right, let's try this for the 100th time. Apologies for the tech issues on my end today. Thanks for hopping in last second for a hard restart in the middle of a meeting. I agree with Dr. Kearns' recommendation. We can connect with Member Payson about this particular recommendation. And I would also add, if it is of interest to the committee, the way that Colorado framed it is a little bit different than what's proposed here. Would you all support kind of including both as Jose discussed in his presentation, and then offering the opportunity for some kind of integrated language as this is presented to Member Payson?
Chair Johnson, Eric, for the record, what I liked about what was presented by the gentleman from Colorado was how simplified that was. So if there was a way that we could get to a similar level of simplification, I think this has a better chance. I also like what I heard from both Debbie and Senator Doñate, that if we can, and from Dr. Kearns, if we can get this in front of our representative who could share this with her friends in law enforcement and get their perspective, that would be very helpful.
All right, thank you. I think that sounds like a great plan. We can work with staff to get some this language and engaged with Member Payson and other law enforcement leaders to understand what modifications we need to make. Ms. Nadler, do you still have your hand up related to number 10?
I didn't realize that. I'm sorry.
No, no worries. I just wanted to make sure. And Senator Doñate, did you want to add another comment or question?
Yeah, just really quickly regarding this. So I did look up the reason why I have my hesitation is I did look up the NRS 453.554, and a good chunk of the part of NRS deals with things that I would believe are covered as part of your recommended change, and it would change it. That's part of the NRS significantly. There are parts that don't include as part of drug paraphernalia, so I think we would, if we decide to proceed with this recommendation, I would request that we at least understand, does this make essentially the job more difficult for our law enforcement in the long run? So I mean, that's pretty much what we need to make sure that ultimately, right, we want folks to receive the care that they need. But under the way that it's described right now, if I'm interpreting it correctly, it kind of changes the entire section of NRS. So that's the only request that I would have.
Thank you for that recommendation. Any other comments on number 10 by the committee? Seeing none, I am going
Chair
to
Johnson,
move.
this is Terry Kearns. I'm so sorry. I just wanted to add, we also do have, he's not a member yet, but serves as a subject matter expert from the DA's office. So we could also push it to them. And then if we wanted to send it to the public defenders as well, we do have a contact that we could send to them as well.
I would support the comprehensive sort of subject matter expert review. I know this is written very much in the grounding in public health and evidence base around that. So it sounds to me like that those considerations would be important if and how to modify this recommendation. Would the committee support that those SMEs weighing in to then bring back language for review at a future committee meeting?
Very much so. I think we need to.
Sorry. Yeah, I agree. Debbie Nadler.
Thanks, Debbie. Thanks, Eric. All right. Let's move to recommendation number 7. So presently recommendation, and so these are obviously referencing the annual report, is around a recommendation to DHHS to utilize opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada, and basing this on the state's naloxone saturation plan, creating a stable and sustainable source of overdose reversal medication within the state. Presently, the state, my understanding is that the state opioid response grant is responsible for overseeing the state naloxone saturation plan, and is currently participating with many different federal partners on a federal policy academy to expand and create a more robust way of creating naloxone saturation. And the state opioid response grant, also called the SOR grant, does have dollars presently to support the purchase of naloxone, and is, I think, looking into a management system for how to increase accessibility of this naloxone to more community partners, citizens across the state. But just for reference to this committee, this recommendation is specific to the settlement dollars and creating with the eye to a sustainable source, since the state opioid response grant is a grant through SAMHSA. So I wanted to elevate this to see if there are any changes or recommendations from this committee for consideration to this current ranking. Any suggestions from the committee? Senator Dunyate, is your hand up or still up? I didn't want to miss you if you had something to say. Thank you, sir. Ms. Nadler.
Would this be a spot to put, and I don't know if it is, but something in the classrooms? I know I talk about this all the time. I wish we had something where we had it at least in high school and colleges. I mean, at least in, high school. That it's just, again, that the bill doesn't require it. It says shall or may instead of must. Would this be a place we could get the Narcan?
Thanks, Ms. Nadler, for your comment. I hope that I'm understanding it correctly. So so you're referencing naloxone on school campuses, and presently my understanding is that it's available for response, but not for access. So this particular recommendation, as I'm reading it, is really focused on increasing opportunities for naloxone access.
Okay.
So, Chair Johnson.
Mr. Schoen?
Yeah, so the way in which you presented this was a very nuanced presentation, and if memory serves, I think this push for more accessibility throughout the state was something that was important to you. Do you have thoughts or ideas about what we might do here?
Yeah, thank you, Mr. Schoen. So I think I view this as a recommendation around sustainability. So for me, keeping naloxone access in the state, regardless of federal grant funding or priorities, should be a high priority to ensure that we're able to have access to overdose reversal medications as one component of many components of comprehensive evidence-based overdose response. And I would welcome the opportunity to amend this and any recommendations from the committee. But my concern as I look long term is this is currently based on grant funding to reach this goal, and that that may or may not be something that's always available to the state.
Understood. I thank you for that more complete explanation, and that was a good refresher as well for the rationale that you provided with us for the first time. I agree with you completely. It'd be nice to have a dependable, regular supply and a commitment to that supply. And what I'm hearing you say is, rather than make it contingent on grant funding, is there a more predictable, sustainable, regular source of funding that could support this?
Correct, or a system in place that creates, for lack of a better word, like a safety net in case these dollars were not available for this access, that we could utilize a braided approach to ensure ongoing sustainable access to overdose reversal medication. This is just sorry, I didn't mean to interrupt. This is an approach Rhode Island and other states have taken.
And we have Rhode Island give a presentation, didn't we?
Yes, I believe we had an SME from Rhode Island speak about their work.
Yeah, okay. Unfortunately, I don't have any genies left in my bottle to ask how. It's a compelling vision that you've outlined for us, but I don't know exactly how to get more specific on this.
Yeah. Perhaps some more language centered around sustainability. So identify a sustainability plan for naloxone saturation, utilizing, a variety of funding available. So framing that recommendation to DHHS for a sustainable saturation plan over time might be a more effective wording of this recommendation.
I was just thinking the same. I liked your wording there. So maybe instead of utilizing these specific dollars, we could ask them on an annual or biannual basis to come up with a saturation plan for naloxone or accessibility plan for naloxone that would be regularly revisited and updated.
Yeah, I think that makes sense. If the committee is open to it, I'm willing to take these recommendations on to workshop and bring back at a future meeting for your review and feedback, unless there's any additional comments today.
Well, that's too good of an offer to pass up. Please do.
All right. Let's move on to recommendation number 8. Thank you, Emma, for advancing us along. So recommendation number 8 is around implementing changes to recruitment, retention, and compensation of health and behavioral health care workers to enhance the compensation in alignment with the letter mentioned here from 2022, and to continue to sustain and expand investment in community health workers, peer recovery support specialists, and certified prevention specialists by implementing changes to recruitment, retention, and compensation. I am very interested in any recommendations from the committee about how to, if they're around reformulating, reconceptualizing, rewording anything that's in here to increase actionability, or any feedback you have.
Chair Johnson, Eric Schoen for the record. So in the conversations that I've been having with groups who have an interest in this, the figure we're kind of landing on, that would be nice for a reimbursement rate, is somewhere in the neighborhood of $40, $45, $50 an hour that would get paid if this were actually in effect to the agency, so that they could pay their overhead, and then they could pay benefits and basically a livable wage of $25 an hour for community health workers and peers. And we're not anywhere near that at this point in time, but there is an appetite and an interest for increasing that reimbursement rate, as well as the monthly cap that's currently in place. Community health workers cannot bill for very many hours monthly, and so trying to increase those caps as well. So I just offer that as context.
Thank you so much, Mr. Schoen. Senator Duniante?
Thank you, Chair. Just a question, and then I can do my comment after. This recommendation is directed towards who? Would it be towards DHHS, towards the governor's office? Is it a bill request? Like which one is it? I guess that would be my first question.
Yeah, I think that's a great point, that it does need some additional wording and direction at this juncture. I think this is also a combination of maybe a couple of them over time. So would defer to your and Mr. Schoen's expertise if you have a recommendation.
Well, and then Senator Doniate, I want you to ask a question, but in my mind, some of these early recommendations that we've made in these first annual reports are more like shout outs to folks. Say, hey, if this is a priority for you, please know that we recognize that this is important, and we haven't been more specific than that, not knowing who might want to pick this up and run with it. So what I'm hearing in this conversation is if we could be more specific on some of these, it might actually help them to get across the finish line.
Senator Zanyate.
Thank you, Chair. So in terms of my recommendation, given that we just went through the same process through the Committee of Health and Human Services, the Joint Interim Committee of Health and Human Services, when we receive recommendations like this, usually the more specific and targeted they are, the better off that they can be implemented. So I would, maybe Mr. Schoen can be more specific in terms of, I mean, which one is it? Like, if there's a priority, is it recruitment, retention, or compensation, right? And if it's one of those, and if it's through a rate enhancement, then I would recommend that we maybe reword this recommendation and instead say request from the state Medicaid director a state amendment plan to increase the reimbursement rate for CHWs by say 10%, right? And whatever that number or finite number is, that way they can include it as part of their recommendations. And so as Medicaid goes through their rate reviews, this can help them identify where to focus their efforts on versus kind of making it generalized. Or I mean, if recruitment is the biggest priority, then obviously we can structure a recruitment program for CHWs or et cetera. But I think being more targeted and specific probably makes sense. But for this recommendation, if it's reimbursement, doesn't necessarily have to be a bill draft request. It can just go directly to the Medicaid director, in my opinion. Obviously open to suggestions.
Chair Johnson, I will volunteer to try to draft something, and then Senator Doniate, maybe I can run it by you as a second set of eyes to make sure the language that we're clear. Okay. And I'll focus on reimbursement, if that's agreeable to the committee.
Fantastic. I thank you so much, Mr. Schoen. Dr. Kearns?
Thank you, Chair Johnson. I just wanted to add that after I presented the recommendations from the 2023 annual report, there was some interest from some of the policy boards, specifically in this one. So I think it might be a case of reaching out to, I want to say, the Washoe Regional Policy Board, because I think they took this one on and may have looked at some of the language and what their recommendation was going to be as well.
Okay. I'll reach out to Dorothy.
Thank you, Dr. Kearns, and thank you, Mr. Schoen, for taking on some additional workshop language to bring this back to the committee for review and support. I appreciate that. Any other comments on number 8? I'm going to move to recommendation number 13. Wonderful. So this one we have a subject matter expert, Marco Mendez, on from the Southern Nevada Health District to talk about a little bit of the implementation of the health district on a drug checking program and perhaps offer insight into this current recommendation. So as it currently reads, establish a statewide initiative for community drug checking that incorporates qualitative and quantitative checking and includes the following parameters: work with the harm reduction community to identify partners, locations, and provide guidance and training. Start all sites with mail-based testing while piloting on-site drug checking in a subset of early adopters. Standardize the data collection, entry, testing, mailing analysis as a best practice, and then articulate the principles and plans for what will happen with the data. Mr. Mendez, wondering if you could offer any initial insights, a little bit of background on some of the project that you've been implementing at the Southern Nevada Health District, and any initial insights or modifications to this recommendation for the committee to consider.
Yes, thank you for the opportunity to speak today for this subcommittee. So our drug checking program here at the Southern Nevada Health District involves sample collection at outreach events and through partner agencies. It's mail-based. We work with a lab in Maryland through the National Institutes of Standards and Technology to perform qualitative testing of drug residues from used paraphernalia. So we have piloted this program in late 2022 and have fully implemented it with our overdose data action funding starting on September 1 of 2023. And we have been able to sample and receive results from roughly 600 paraphernalia items so far. It presents minimal cost to the health district to use this mail-based program. And as the supplies for sampling are provided by the lab, so costs involved are essentially just for mailing to get the samples to the labs. Is there any other detail I could provide?
Committee, are there any questions for Mr. Mendez about the initial drug checking project? I think our goal was to bring in an SME who could provide kind of an example of how this has been rolling out. Hearing or seeing no immediate questions. Mr. Mendez, wondering if you have any recommendations based on sort of what you've been able to review so far for this SURG recommendation or modifications based on the experience from implementation so far?
Yes, I think upon my initial review, my initial recommendation relates to the beginning language, so establish a statewide initiative for community drug checking. The way that I read this and the way that I interpret this is that this implies a centralized data collection for the whole state of Nevada. My recommendation would be to perhaps include language supporting regional implementation of community-based drug checking with perhaps standardized measures that could be shared statewide for the sake of reporting throughout Nevada. But I think that local jurisdictions are best equipped to respond to findings from community drug checking. So I think standardized statewide variables would be useful, but I think the overall approach would be best would best not be statewide. Sorry if that does not make sense. But definitely support a regional implementation approach.
Thank you, Mr. Mendez. Any additional questions or commentary in general on this recommendation from the committee? Hopefully I'm not frozen yet. And so I'm hearing an opportunity to make some amendments to this that look for a regional or more localized implementation of the plan that then identifies some statewide surveillance indicators that might be beneficial for overdose prevention means. This particular recommendation is also presently very focused on kind of a how-to guide for implementation. So wondering if there are any additional guidance or recommendations from the committee and how to focus this recommendation a little bit more effectively.
Chair Johnson, Eric Schoen for the record again. For me, this is one of those aspirational recommendations that we had. It would be wonderful. I have so little experience in this directly that I feel like a rank beginner even trying to offer how we might start this. But I know that the value of this, if we could have, an up to the second updated database that people could check in on and see what was coming through the drug supply and have a way of being better informed, I think it could make a huge difference. I just don't know how to go about doing it.
Thank you, Mr. Schoen. Senator Doniate?
Thank you. If there was a way to do this, obviously it would be facilitated under DPBH from the state side, but as some folks may know, the health districts have been receiving dollars through the newly established Public Health Improvement Fund. So you could potentially tie the public health improvement dollars that they're going to be receiving next year towards implementing some sort of program as to what's being implemented now. And maybe require the health districts to develop a plan towards starting towards going towards this, especially since they're receiving funding. But that would be my only recommendation of where you can pull the pot of dollars and where you would start.
Thank you for that recommendation. Would that would provide for a regional approach, and then would also make way for rural communities as well? Just thinking to Mr. Schoen's point about broad implementation, or that would at least connect to the population centers?
Through the proposals of the new public health improvement fund, so it was already established during the last legislative session. Next legislative session, there are different entities that are going to be receiving it. So the health districts will be receiving it, and then every county under the new formula also receives a base funding. And so all counties will have additional discretion of how to use those dollars. And typically DPPH coordinates for the rural counties. So essentially, for those who don't have the infrastructure of the health districts, it would be through coordination of DPPH, which is why I was mentioning that a statewide initiative would have to be guided by them. So
Thank you. That's helpful guidance. Other comments from the committee and how to modify recommendation 13? All right. Hearing none, thank you, Mr. Mendez, for hopping in with your experience so far in implementation and some opportunities to consider for this committee. I appreciate that. You're also, again, welcome to stay on and provide feedback on any of the other items.
Thank you.
I am going to move to number 15. So number 15 is related to the peer recovery support specialist. So the recommended bill draft request to equalize peer recovery support specialist, so it is equal to or exceeds CHW reimbursement. Add an educational requirement around evidence-based harm reduction to both peer recovery support specialist and a CHW certification.
Chair Johnson, Eric Schoen for the record, the Nevada Regional Behavioral Health Policy Board, or Northern Regional, I can never remember what the whole alphabet stands for, but representing Story County, Lyon, Douglas, and Churchill counties, Carson, shoot, something like that. Anyway, 4 or 5 counties. That policy board is specifically putting forward some recommendations directly related to peers that would help to accomplish this specific goal. And the idea would be essentially to elevate peers, and similar to what Senator Doniate recommended, working with Medicaid to see what we could do to raise the Medicaid rate, but also cleaning up some of the language in NRS that seems a little bit restricted right now, so they could be more widely utilized. We would have to get those specific recommendations from Sherilyn Rarwood, who is the director of that policy board. But we are trying to move forward in that policy board with this, with helping to support peers.
Thank you for that feedback, Mr. Schoen. Apologies for the unmute button escaping me briefly. So is it of your expertise and recommendation to leave this as currently is, or are you intending to do some connection with the policy boards for refinement?
You know what? I thank you for planting that seed. I will specifically circle back around with the language as is written here, share it with the policy board, and see what kinds of thoughts and feedback we might get.
Thank you. I'm also open, and I don't know the rest of the committee, if this makes sense to include under the previous peer agenda item, it seems like it would likely be separate, but if reimbursement is the direction that that particular recommendation goes, that was number 8.
Okay.
That this might be able to be combined into
Okay.
a single recommendation, but open to the feedback from the committee.
I think you're right. I think they could potentially be combined. So let me do a little bit of sleuthing on both of these and see what we can, see what we might be able to do.
Thank you, Mr. Schoen, for your due diligence in bringing that back to the committee. I appreciate it. We have a few more recommendations, or one more recommendation for harm reduction. So I'm hoping we can move to that next. This is number 18. Thank you, Emma. So number 18 is creating a recommendation to the legislature modeled on Maryland STOP Act, which authorizes certain emergency medical service providers to dispense naloxone to individuals who received treatment for a non-fatal drug overdose or who were evaluated by a crisis evaluation team and require certain community service programs, certain private public entities and hospitals to have a protocol to dispense naloxone to certain individuals free of charge under certain circumstances. For discussion, I have received feedback from some of our SMEs and just wanted to clarify that it doesn't seem like there's a modification needed. So Nevada's existing Good Samaritan law seems to already allow for all of this to take place. So I wanted to start with that really the vision behind this recommendation was for an enhancement or a strategic engagement with different types of services regarding naloxone access to people who might be in a particular time of crisis or receiving services related to a non-fatal overdose. So wanted to bring this up to the committee if there is a specific recommendation around how to reword this, or if the committee would recommend not moving this recommendation forward, since just to be clear, this is already allowable in Nevada law, but is a more strategic kind of engagement with different systems that might be engaging with people who are having who are experiencing non-fatal overdose. Any thoughts from the committee on?
What? Sorry. Chair Johnson, Eric Schoen for the record. It takes me a second to catch up with where you're at sometimes. So it sounds like part of this is already covered, meaning sort of being able to administer or provide naloxone and know that will be sort of held harmless for doing that. That part's covered. But then the other portion of this, the thrust of this that I'm seeing, is the protocol to dispense naloxone to certain individuals free of charge under certain circumstances. Are you thinking that maybe just narrowing it on that would be enough for this recommendation?
Yeah, so one strategy might be to think about ways to incentivize different providers or provider types who might interact with folks experiencing non-fatal overdose to provide overdose education and naloxone to those individuals, or wraparound services for folks to engage in care and recovery services. That may be a little bit outside the scope of the prevention subcommittee and might get into some of the other work of our treatment and recovery colleagues, but perhaps one strategy might be to identify ways to increase incentives for individuals to be provided community naloxone in some of these settings, or naloxone free of charge in some of these circumstances.
Can you give me, so I'm having a hard time wrapping my brain, like what would be an incentive for a provider, like a tangible incentive?
That's a great question. I mean, perhaps reimbursement for the education provided. That's off the
Okay.
top of my head. I don't know if anyone has more experience than this on
So no, that's
this
what was
committee.
coming up. That's what was coming up for me, and I thought I was maybe being unimaginative because I thought maybe you were imagining other possibilities. So thank you. That's what I was imagining too. Okay.
Any thoughts from the committee on either not moving this recommendation forward or changing it to instead be more focused on incentivizing? Dr. Kearns?
Thank you, Chair Johnson. I certainly don't want to offer any language to you, but what I wanted to add is that we have had presentations from the Nevada Opioid Center of Excellence, the NOCE, and they have talked about there are places around the state, such as EMS, who are doing CPR classes, and they do provide education on naloxone and do provide it in those classes free of charge. We also do have some EMS, not all, throughout the state that are doing leave behind, and I believe a few police departments, sheriff's offices are doing that as well. So I just wanted to provide that from some of the background that we've received in the response subcommittee related to leave behind programs or distributing and education on naloxone.
Thank you, Dr. Kearns. With that information, any further thoughts from the committee at this time? I'm also keeping an eye on the time. So if nothing immediately comes to mind, also happy to move forward. Go ahead, Mr. Schoen.
Yeah, just a quick. So Dr. Kearns planted a seed in my head of imagination that if we had this, not that this could happen, but maybe it could, if this were like a regular part of CPR classes, right, then this would be something that would have perpetuity in terms of exposure for people to get educated around naloxone and how it can be utilized. So if there were a place like that we could fit this in, that could have some real depth.
Yeah. So so hearing what you're saying, instead modifying this to require overdose education and how to administer naloxone as part of CPR courses administered in the state, and then provision of naloxone would either be up to the individual and or to connect to one of the sort of locations where there's no cost naloxone available through the state or other programs.
Well, on the face of it, that's a very compelling idea. I think we'd have to do a little bit of a deeper dive so we better understand the pros and cons of that recommendation, but that's a compelling idea.
Okay, all right. So I'm happy to work with staff to come up with something a little bit more concrete along those lines if the committee supports that, and bring it back for further discussion at a later subcommittee meeting.
Yeah, I'm ready now. That sounds really interesting to me.
All right, fantastic. Any other comments from the subcommittee before we close agenda item number 5? Hearing none, I wanted to thank our subject matter experts who dedicated their time to weigh in today and help us to continue to refine this work, as was a vision of this group earlier this year to continue to bring these important areas forward for Nevada. With that, I'm going to move on to agenda item number 6. Looking to hopefully accomplish this briefly. So this is for upcoming prevention subcommittee meetings and next steps. So I just wanted to take the opportunity to review that there are 2 additional meetings before our October SURG meeting, where all of the prevention recommendations will be reviewed. We'll be meeting on August 26th. We'll have this is a presentation from our community health workers. We'll have a prevention programming in schools presentation, and any remaining 2023 recommendations will be workshopped during that meeting. If any new recommendations have been submitted, we will also consider them at that time. We have heard from Ms. Nadler and others about an interest in some type of a recommendation around school ID badges. And I don't know if Member Nichols is available to share about the CCSD's details from the NRS about ID badges in schools.
Hi, this is Angela Nichols. So I'm sorry, I don't have it
Thanks.
hi. I don't have it in front of me right now, but the email that I sent, it's Safe Voice, the suicide hotline, that per that Senate bill and per the NRS, that those do go on badges. And so like the photographers who do the ID badge pictures, they have that prepped and it's all there and ready to go.
Fantastic. Thank you, Member Nichols. Yeah, I just pulled up the email. So it was Senate Bill 249, Nevada Revised Statute 388.14553. The student identification badges are required to include information on the National Suicide Prevention Hotline, the 988 line, and the Safe Voice line with the website as well as the number. Hopefully, if there's any additional, I guess, recommendations related to engaging this information around school ID cards, would be happy to add that to a future meeting or share that with staff so we could best get that those recommendations out for implementation. Ms. Nadler?
Hi, thank you, Debbie Nadler. Is this something that's going to be in effect, or it's something that's already being done?
It's been done for years, like minimum since 2020.
So is it in all the schools?
As far as it is, so right now, I guess just for some background, is that as of this year, all students are mandated to wear their ID badges. So the information being put on, I'm going to say since 2020, roughly, it's been happening. It's on the back of every ID. This year, we have a little bit more information on the school sites because with the mandated ID, there's a lot of things that we're having to figure out. So for me, for instance, I don't have a big school site. I don't have anybody who can print anything. It's too expensive to get a two-sided printer. So I'm just putting a sticker with that information because it is mandated by law that if I hand out an ID, it has to have that information on it.
Okay, just because my kids' school that they used to go to, their middle schools and high schools don't have them as of this year. So I just wondered if somebody was checking if it was mandated or not, or
it's absolutely mandated. It's in our regulations and policies, and it has been in law, I want to say at least since 2020, but I could be off on that. It may have been that it was recommended, but it is absolutely required now, and it is not new this year. I know for a fact that it's not new this year.
So so what happens to a school that's not doing that?
Someone I would assume would have to know about it. If I'm coming from it, I don't know. I'm thinking if I'm an associate superintendent in the Clark County School District and I visit Smith High School and I'm looking at Smith High School badges and they don't have it, I'm having a conversation with that principal. But because we all know we have to do it. So I can only speak from what would be a supervisory space on mine. If it's not happening, it may be worth, if you never talk to the principal, why isn't this happening? And if it's not remediated, then it's same thing like, talk to the school associate superintendent, and you'd have to do it that route. I don't know if there would be like a state contact or why you would. This one high school isn't doing a thing. I might have a conversation with the principal first, but everybody is supposed to be doing it.
And is it middle school, or does it include elementary school as well? Or is it just middle school and high school?
Don't quote me, and I don't have the paperwork in front of me. I'm so sorry. The middle school and high school, I can say for sure. I want to say elementary school as well, because if an ID goes out, it has to have that information. The ID requirement may just be at the middle, like the kids have to have the ID on them, may just be at the middle school and high school level. But if there's an ID that is distributed, it has to have that information on it. A school ID that's distributed.
Okay, so it has emergency contact numbers, suicide hotlines, and all that.
But and the
Debbie,
safe voice, whatever.
Sorry. Yeah. Sorry. Go ahead, Ms. Nichols.
Oh, whatever you were good. Yeah, because you have it up in front of you. Whatever the safe voice and the hotline. Yeah.
Yes, and Debbie, I'm happy to follow up with the specific NRS after this meeting and work with staff to do that.
Okay.
But
thank you.
National Suicide Prevention Hotline, the 988 line, and then the Safe Voice hotline as well.
Thank you. Thank you.
So I think if there's any additional recommendations beyond that for school IDs, we could entertain those at our August 26th meeting. Next slide, please. I know we're 2 minutes over time. I'm just hoping to wrap up agenda item 6, if that's okay. And then September 4th will be our last subcommittee meeting before the full SURG considers preliminary recommendations on October 9th. So we will finalize our wording to be presented at the October 9th meeting, and then take any feedback from that meeting on November 6th and finalize our recommendations for the 2024 SURG report. Any questions? Oh, sorry. And I think there's one more slide about the November meeting. Oh, wonderful. Just in September, and then we'll meet again to finalize that feedback. Any questions on agenda item number 6? Hearing none, in the interest of time, I am going to move agenda item number 7 to a future agenda, which will talk about the approaches to recommendations in the ranking process that staff can cover, and a discussion. So we can move to agenda item number 8, which is our final period of public comment. Ms. Rodriguez, do you mind taking the lead on this?
Yes, please raise your hand if you'd like to provide public comment. And as we noted in the first period, there are directions for if you're dialing in from the telephone. So I'll just pause for one moment. And Chair, I'm not seeing anybody indicating that they'd like to provide public comment.
Thank you, Ms. Rodriguez. With that, we'll move to agenda item number 9, which is adjournment at 4:34. Thank you for the 4 extra minutes of your day and your patience with my tech issues on Zoom. Appreciate this committee and the work that you're doing and engagement. And again, a big thank you to our subject matter experts who were able to join today to help move forward these harm reduction recommendations. Have a wonderful rest of your week, everyone.
Okay, take care,
Thank
everybody.
you, you too. Bye, Jessica. Bye.
Thank you.